Hi, my name is Jill Garber, and the advanced assessment scale that I'm going to be performing today is the NIHSS stroke scale. This would be administered to patients coming to the hospital with a suspected CVA. It's first administered in the emergency room and then would be administered upon admission up to our floor, and then every 24 hours after that until a patient is discharged. So what we're actually doing with this scale that we're performing is to try to in some way assess the deficits they've had from the stroke that they've actually has occurred. If they have had a stroke in the right side or the right cerebral hemisphere, their deficits will be on the left-hand side of their body, and if they've had it in the left side of their head or cerebral hemisphere, the deficits would be on the right side of their body. This scale is broken down into 11 different areas, and essentially we're assessing their level of consciousness, their orientation. We're also taking a look at their visual field and their eye gaze, and then we're assessing their motor skills also. And the last thing that we work with is their language to assess whether language has been affected or not. The stroke scale is, again, 11 different areas, and they're rating 0 for anything that they have perfect on. So each category is rated on its own. 0 is the best score that they can get. 3 to 4 is the worst score they can get. So the worst or higher number shows that they have a higher deficit in that area. So we'll start with Savannah by asking her, we're trying to assemble some idea of her level of consciousness. So in the level of consciousness, they can be alert the whole way down to being in some type of a coma. Savannah's sitting here with us. She's responding. She's looking at us. So she would receive a 0 because she is actually alert and aware of her surroundings. Sometimes we will ask them a few orientation questions, like we might say to her, what is your name?
Savannah Garber.
Where are you today?
At my house.
Okay, do you know if it's morning or evening?
Evening.
And who is the President of the United States?
Trump.
That would give us a little bit of an idea of whether she knows what is happening in her surroundings or not. We also would assess some level of consciousness questions. These two are specific questions that we need to administer on this test. The first would be, what month is it?
October.
And then also would be her age.
23.
Okay, so she would receive a 0 on this because she got both right. She has to get the question completely right. When we administer a stroke scale on someone, we are not assessing what we think they are able to do. We are assessing what they are able to do. So if I had asked her what month it was and she had given me her birthday, that would be a wrong answer, even though she might have told me 5 minutes ago what month it was. We're administering the test now, so she would have had one wrong and she would have scored a 1 on that portion. Then we're going to move on to the level of consciousness commands that we do, and they are specific as well. We're going to ask her to open and close her eyes, and then we're also going to ask her if she can make a fist. So again, we're starting to get an idea of which side of the brain may be affected by this stroke, whether she can make a fist in her left or her right side of her hand. Now we're going to move on and we're going to check for facial symmetry for her. We can do that by doing 2 things. The first thing we can do is ask her to smile for us. Okay, then we can ask her to raise her eyebrows. Okay, and then sometimes we'll ask them to stick their tongue out. So what we're trying to see here is if there's any droop of any kind on one side of her face versus the other side. Sometimes when somebody has had a stroke, they have some numbness in their face and they're not able to move their face completely. So we're looking for facial droop of any kind when we test that facial symmetry. Now we're going to take a look at her eyes. The first thing we're going to do is we're going to test something called the gaze. We're doing that by having Savannah follow my finger with just her eyes, but with no head movement attached to it. So you're going to hold your index finger out here, and you're going to slowly work your way back and forth, up and then down. And so we're just making sure that her eyes are able to follow you. The second thing that we're going to do is actually look for any visual loss in some of her visual fields out here on this side. So I'm going to have her cover her right eye, okay? And then I'm going to assess for visual loss over here by putting a finger up. And you're going to have her look at your nose, and you're going to tell me how many fingers?
3, 2.
Okay, so Savannah got one of those wrong. So by getting one of those wrong, we would have to score her as having a partial vision loss on her left side at this point. Now, we're going to have her again, we're going to test the other side. Stroke side, when we're doing the stroke scale, we always do to one side what we've done to the other. So now we're going to have her cover that eye, and she's going to look at me with her nose, and she's going to tell me how many fingers she sees.
2.
Okay, so far along with her stroke scale, she is a score of 1. That is where she's at right now. We're going to move on to her motor skills. We're testing the upper and lower motor skills. We're going to start with her left arm over here. We're going to have her raise this. Upper arms are always to 90 degrees, and she's going to count for us to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, what we're looking for is drift. If her arm would be coming down so that she's unable to hold that 90 degree, the worst off would be a score of 4, which means she's not able to move her arm. So the score would be between 0 to 4. She is a 0 at this point because she could hold her arm up there. We also are going to have her do the same to this.
1,
and
2,
count.
3, 4, 5, 6, 7, 8, 9, 10.
Great. Now we assess the legs as well. They are held off of the bed at 30 degrees versus the 90. So we're going to ask her, yep, you can lift your leg and count to 5 instead of 10.
1, 2, 3, 4, 5.
Good. And this one?
1, 2, 3, 4, 5.
Okay. So there we're looking if she's having any drift. Sometimes they have drift in their upper extremity, but not their lower extremity. Sometimes it'll be both extremities. So we're measuring drift in both sides of the body. We're going to test sensory perception now by having her close her eyes, and I'm going to touch different parts of her body. Sometimes you can use something blunt like the end of a key or the end of a pen. We're trying to assess for numbness. So close your eyes, Savannah, and tell me where I've touched you.
Left shin, right thigh, left arm, right cheek.
Okay, so we're testing all the sides of her body just to see if she is numb in any of these areas. And then the last area of sensory that we're going to do is we're going to test for ataxia. We do that in the upper extremity by I'm going to hold my index finger out, and she is going to quickly touch her right index finger to her nose and back to my index finger. And she'll do this as quickly as she can as we're moving our finger around. And then we'll test the other side of the body as well. Okay. This can be performed in the legs as well, where we have somebody put their heel up to their shin and move it up and down. Great. And this side. Okay. So she could have scored a 1 or 0, 1 or 2. 0 is there's no ataxia. She might have scored 1 if it was her upper body, 2 if it was her 1 if it was her lower body, and 2 if it was both together. So we've tested those. Now the last we're going to look at is the 2 different speech problems that people can have with this. The first one we're going to take a look at is we're going to test for dysarthria. Dysarthria is a problem with their speech pattern where they're not able to speak clearly, but they actually slur some of their words. We have her reading these words for us on the right-hand side to listen for slurring.
Mama, tip top, 50-50, thanks, Huckleberry, baseball player.
Okay. And so she got those all right, so her score would be 0. And then we're also going to test for something called aphasia, and we do that by testing her ability to remember or recognize these objects.
Glove, chair, feather, key, hammock, cactus.
Okay. Aphasia can happen for patients in 2 different ways. It can be receptive, that they're not able to understand what we say, or it can also be expressive, that they are understanding what we're saying, but they do not understand, they're not able to actually get the words out. So those are the 10 areas we test, And the last one we look for is extinction. Sometimes that's a little bit harder because we as nurses are assessing their ability to use one side of their body or not. Do they recognize whether that is still there or not? So we take a score of all of these, and these we would add all of the columns together, and Savannah would come out with a 1. As the patients are with us longer, if they started at a 17, we're hoping as they leave that they're going to get better and better and might work their way down to like a 10 or sometimes a 7. Some of the other things that we assess as nurses for stroke patients would be dysphagia screening, their ability to swallow. If they have any problems with that, then they are made NPO to a speech therapist sees them. We also test their strength or weakness in their hands by having them squeeze, and then in their feet by bringing your feet up here, pushing down like a gas pedal and pulling back. That tells us, are we working with hemiplegia or they're actually hemiparesis? What's actually happening? And then one of the other important theories of assessment is their prior level of function and their function today, so that we know how to get them back to the level that they were previously. Thank you for listening to my stroke scale assessment. It's been a pleasure.